Hi everyone, the topic that I chose to talk about today is health insurance options upon retirement. Working in the health industry, I've always been curious as to many options of health insurances and how people pick the right insurance for their needs. Many employers do not offer continued health insurance upon retirement. The average American will receive Medicare when they reach age 65 and may have Part A and Part B, but many people will need a supplement to this insurance. As I researched the topic more, I was able to find out that most state employees, which there are thousands just alone in New York State, have retirement health insurance coverage upon as part of their benefits. Some of our local hospitals, they have thousands of employees, but they do not offer health insurance as part of your retirement package. So it's important to do your research when you're looking for a career, or also to find out what your options are upon retirement. It's more than just putting in your 30 to 40 years of service. It's also important to know, am I going to be covered when I'm done working public service? So the research that I found is obviously at 65, everybody gets Medicare. If you're not sure what the Medicare card looks like, it does look like this. Typically it has your social security number on it. Starting in April, they're removing members' social security numbers for identity protection, which is a good thing. Medicare has been around since 1965. The government pays Medicare's share of your medical bills directly to your providers and hospitals. Medicare is not free. You're still required to pay some of the out-of-pocket expenses. There is a yearly deductible for hospital stays, and you have a 20% copay for outpatient treatments like doctor's visits, which can be very expensive if you unfortunately aren't healthy, or you have dialysis or chemo treatments. You still have to pay a portion of that every year. There is no deductible. When you had private health insurance, most places have like a yearly deductible, say of $3,500. With Medicare, you don't. It's unlimited, so you can still keep paying. Unlike your previous insurance from your working years, there is no deductible to meet, and Medicare does not have a limit of what you can spend out of your own pocket, so it can get very costly. To help cover the cost of what Medicare does not cover, you can pick up another insurance plan to cover the gap. This is referred to as a Medigap policy and is secondary to your Medicare. This was developed to provide extra protection beyond Medicare. According to Medicare.gov, Medigap policies coordinate benefits with Medicare and will pay as secondary only when Medicare approves payment of services. Medigap policies are private insurance companies that assist with healthcare costs like copays and deductibles and co-insurance. The average Medigap premium each month is about $150 to $200 and has low out-of-pocket costs. The downside to many Medigap policies is they do not cover prescription drugs, so you would need to purchase a separate plan for that. So in your wallet, you'd have your Medicare card, you have your Medigap card, and you'd also have your prescription plan card. Another option is you can opt to skip Medicare, pick up your own policy, which would be a Medicare replacement plan. An example of a Medicare replacement plan, this is Aetna, and it would say right on it, Aetna Medicare, so that you know this is a replacement plan, not a supplement. AARP also has a Medicare plan, and if you can see, it does list your copays and your co-insurance and stuff like that, so it's kind of handy for the member. So with the Medigap plan, the Medicare replacement plan, according to consumerreports.org, anyone on Medicare can choose to receive their Part A and Part B benefits through a private health plan instead of going through original Medicare. The upside to Medicare Advantage plan is it does come with prescription drug coverage. Most plans typically come with deductibles and copays, but unlike Medicare, they do have an annual out-of-pocket expense. Not everyone needs to purchase a Medicare Advantage plan or even a Medigap plan. If you have Medicare and qualify for low income, you could have a secondary like Medicaid. If you have insurance from your former employer upon retirement, you would not need a supplemental plan because that would just be in addition to what you already have, and it's not going to give you extra coverage. In choosing any policy, always check the policy benefits, the insurance premiums, and the company's reputation. Insurance shopping can be an intimidating time for you and your family. Here's the resources available in your community. When doing my research, I checked with the Clinton County Office of the Aging. They were very helpful. Consumer Reports has a lot of prices listed that you could check out to see what's offered in your area as well. I hope some of this information was helpful to you guys. Thank you.